Hello, my name is Jim Armitage and I'm a professor of medicine at the University of Nebraska Medical Center. I'm often asked what risks should be taken into account when treating a patient with Hodgkin lymphoma. And this has become an increasingly pertinent question because we cure most people that we treat with this disease, and so you'd like to leave them with the least injury in the long term. Now, I would argue that risks come in several categories. The first are the immediate risks from the therapy, and these are usually infection related. So if you're giving a medicine, a combination of medicines that lead to severe myelosuppression, then trying to anticipate or prevent sepsis is a big goal. Obviously, you'd like to treat the unpleasant side effects of therapy. But today, most of our worries about risks are actually long-term risks. And the two most serious long-term risks that patients treated for Hodgkin lymphoma have, once you get by the disease itself, of course, you don't want to die of the lymphoma, then the two long-term risks that are most important are second cancers and cardiac or cardiovascular disease. Patients also can have a number of other less life-threatening long-term risks like hypothyroidism, for example, or osteoporosis. But to try to minimize the two most important, most lethal long-term risks, you have to consider modifying the therapy based on the characteristics of that individual patient. For example, for second cancers, when you have a young woman, you want to be careful about radiating the breast. In fact, you'd like to not irradiate the breast if you can possibly avoid it. You'd like to not use alkaline agents, which have the advantage of reducing the risk of secondary leukemias, but also reducing the risk of infertility, which, while not lethal, can be a very important side effect to patients. Cardiovascular risks are much more related to radiation than they are to the drugs, probably, although doxorubicin has potential long-term heart failure as a risk of therapy. But when we can reduce or eliminate the amount of radiotherapy to the heart and major vessels to the neck, we can eliminate much of the long-term cardiovascular risks. By the way, you can't always eliminate those treatments, and all of our treatments have long-term risks. It's very important, thinking about cardiovascular disease, to also anticipate the risks of heart disease. And so you should have your patients on the right kind of diet. They should know it's important to exercise at the appropriate time. They might have screening tests for coronary artery disease. They should be examined intermittently and make sure they don't develop valvular heart disease. And as regards second cancers, women should start mammograms earlier, particularly if they've had radiotherapy, and so forth. These are patients who should have more, not less, ongoing health care, with a focus on trying to not only prevent, but also identify early any long-term adverse events that were related to the therapy of Hodgkin lymphoma.